How does miliary TB differ from other types of TB? Imagine a tiny seed spreading throughout your body, affecting many organs at once. That's what miliary tuberculosis does. Unlike the more common form of tuberculosis that stays mostly in the lungs, miliary TB spreads widely through the bloodstream. This makes it a much more serious and complex condition. Most tuberculosis infections start in the lungs, where the bacteria settle and from small, localized areas called granulomas. These are like tiny walls that contain the bacteria and prevent it from spreading. This form, known as pulmonary tuberculosis, usually causes symptoms like a persistent cough, coughing up blood, and chest pain. It's often diagnosed with a chest X-ray and sputum tests. Miliary tuberculosis is different because it happens when the bacteria escape the lungs and travel through the blood. Once in the bloodstream, they spread rapidly to other parts of the body. The name miliary comes from the millet seed-like appearance of tiny lesions that form in many organs. These lesions are usually just 1 to 2 millimeters in size and can appear in the liver, spleen, bones, lymph nodes, and even the lining of the brain or heart. Because of this widespread infection, symptoms of miliary TB are often more general and severe. People may experience high fever, weight loss, night sweats, and fatigue. They might also show signs related to specific organs involved, like abdominal pain or neurological symptoms. It is especially dangerous for people with weakened immune systems, such as those with HIV or the elderly. Diagnosing miliary TB can be more challenging than pulmonary TB. Chest X-rays show a pattern of numerous tiny nodules scattered throughout the lungs, which is quite different from the localized lesions seen in lung-only TB. Blood tests, tissue biopsies, and other imaging studies are often needed to confirm the diagnosis because the disease affects multiple organs. Treatment for both types of TB involves long-term use of multiple antibiotics, usually over 6 months or more. However, miliary TB requires urgent medical attention because, if left untreated, it can be life-threatening. With early diagnosis and proper therapy, the chances of recovery improve significantly. Risk factors also differ. Miliary TB is more common in people with compromised immune systems, such as those living with HIV, infants, or older adults. Pulmonary TB can affect healthy individuals as well, but the widespread form tends to target those with less immune protection. In summary, miliary tuberculosis is a disseminated, more severe form of TB that spreads through the bloodstream to multiple organs. This contrasts with the localized lung infection seen in pulmonary TB. Recognizing these differences helps ensure timely diagnosis and treatment, which is vital for reducing the risk of serious complications or death. Always consult healthcare professionals for personalized advice and care.